To continue the environmental portion, though, we're going to talk about hot and cold. And so we'll start off with cold. Slowly. It's thinking, I promise. There it goes. So the coldest temperature recorded on Earth is negative 89 Celsius. That's Vostok Station. Strangely, it's colder than the South Pole ever was. However, after the last weekend, I'm fairly certain that Orange Base is pretty close. It was below freezing a couple of the nights there. It was pretty chilly. Actually, the coolest temperature in New South Wales is Crawford Pass. It was negative 23 Celsius. And so it can get pretty chilly here too. Certainly cold enough to get hypothermia. The human body will actually start shivering at about 25 Celsius if not dressed appropriately. But with light clothing and minimal wind, we can tolerate temperatures down to about 0 degrees without significant hypothermia because we have shivering, which can increase the basal metabolic rate by about 3 to 5 times. Now, why do we get cold? There's multiple ways heat exits the body. Radiation is one of them. Conduction, which is transfer of heat from one media to the other, and then convection, which is movement of that media to a different area. So air, you conduct heat into water or air, and if that water or air moves, then it convects away from you is the easiest way to think about it. Radiation's interesting. Yes, we do emit black body radiation in the infrared scale. The physics behind that's a bit complicated. This is a significant amount of the heat loss in still air, but it's not very significant overall. So we don't lose a lot of heat by radiation. We lose enough to pick up on thermal imaging cameras, but that's about it. However, if the wind is moving, again, freedom units, because there's not a wind chill chart in Celsius for some reason. I guess it doesn't exist in non-imperial countries. You realize that as the wind speed increases or the temperature gets colder, you get a more effect. This is only mildly based in reality. It's not exact as it tries to imply. Beyond 100 kilometers an hour, if you're standing out in the wind, you probably should just get inside anyway. I wouldn't worry about the difference in temperature at that point. 60 miles an hour there. There is a formula that is sort of real. But honestly, conduction is the biggest killer. And so the Titanic, it sank. The first rescue vessel was actually there within 2 hours of the ship going underwater, but nobody that was outside of a lifeboat, except for one cook who was particularly portly, survived. So if you were in the water, you died. And that's because water conducts heat 20 to 25 times better than air. So you definitely don't want to be moist when you're cold. Obviously, if your girlfriend is heartless, she should probably put you on the door as opposed to leaving you in the water to die. So, but what does this transfer of heat mean? Well, it means you get hypothermic. So mild hypothermia, so 32 to 35 Celsius, really only 2 degrees different from normal temperature for us, is when you first start seeing actual clinical symptoms. So these people will have decreased dexterity, decreased coordination. They'll actually become more argumentative than they usually are. So it kind of actually causes some personality changes. It makes you a little snippier, I guess. And these people will vehemently deny that they are hypothermic. And that's not just because they refuse to acknowledge it. It's a physiologic issue with the body. Once you get into moderate hypothermia, so once you get below 32 to 28, they start vigorously or even violently shivering. These are the people that are shaking so hard they can't do anything but shake, basically. They really have coordination issues. You're unlikely to be able to get these people to go very far. Severe hypothermia, they've lost the ability to shiver at that point. It's not just that they've run out of energy to do it. So if you're violently shivering, your body temperature will stay around 28 degrees Celsius for as long as you've got glucose to do so. Once you run out of fat cell storage and glucose to shiver, you start getting severely hypothermic. And these people kind of sit still and they don't do a whole lot. Honestly, they'll lay there. And then profound hypothermia, less than 20. These are the ones that look dead. So they don't move at all. You can barely tell they're breathing. Their respiratory rate may be 3 to 6. Their heart rate may be not palpable, but in the 20 range. And the coldest accidental hypothermia patient who ever lived skied into a crevasse where there was a waterfall and hung in the waterfall. And she got down to 13.7 Celsius was her core temperature measured. She lived. Interestingly, the coldest temperature of anybody who ever actually survived was 9 Celsius, because back in the 50s, before IRBs existed, they did a study on a woman with cancer to see if maybe freezing her to death would kill the cancer too. It did neither. She didn't die, and the cancer didn't die either. But she went down to 9, and she came back fully neurologically intact. But she was pulseless for an hour. So interestingly enough, you can live that long. But what do you do once you find somebody that is cold? So if they're in the moderate to severe range, so mild hypothermia, you just exercise them. If you get somebody up and moving and they're mildly hypothermic, yes, shivering increases your basal metabolic rate by about 3 to 5, but vigorous exercise can make it up to 15 times higher. So if you get these people up and moving around, swinging their arms, jogging in place, hill climbing, that'll warm them up just fine. Once they're past the point you can get them to do that, say they're moderately hypothermic and uncoordinated, then you put them in one of these thermal rolls where you get them up off of the cold surface, so sleeping pad and a couple of sleeping bags, and then put a sleeping bag on top of them and wrap them up like a burrito. It works quite well, and their body, which is an engine, will actually warm them up fairly well on its own, as long as they've got some type of nutrition, something to burn. If you've got fire, that's great. Use fire. And in a survival situation, if you don't have the proper clothing, you can sort of insulate yourself by stuffing straw or grasses and creating a bigger air pocket. The more layers between you and the cold air, the longer you will survive. Certainly staring at your cell phone while next to the fire helps. There are a few myths, though. So the comment of, oh, you lose whatever percent your mother told you through your head. It's not that your head is any more likely to lose heat, except that your head is more likely to not be covered at any point. So yes, you lose the same temperature through your entire body, but you don't wear something on your head, you'll lose heat through your head that you're not losing through your shirt. So don't worry about necessarily thinking that the head is special or covering the head and not covering the rest of the body. Because if you cover their head and the rest of their body's naked, they'll still lose heat through the rest of their body. What about a warm cup of tea? So interestingly enough, if you took somebody whose temperature was 32.2 Celsius, and they were 80 kilograms, so body is 70% water, so that's 56 kilograms of water, essentially. If you took a full liter of tea at 43 Celsius and dumped that into a human or into a 56-liter vat of water, it would raise the temperature 0.2 Celsius. So it has nothing to do with the thermal temperature of the water. I mean, yeah, you can burn them or scald them and hurt them, but the warmth makes them feel better. And if you warm up their fingers, you may actually make the hypothermia worse by perfusing cold extremities. So you want to make sure that whatever you give them has calories, because the shivering is what keeps them warm. So make sure it's super sweet. If you make them tea, put 8 cubes of sugar in it. You want it like a super saturated thing. Cold orange juice will do better than warm tea, honestly, without sugar. If you've got the beer cart at the Australian Alps, make sure it's something with some high caloric density, because alcohol will peripherally vasodilate and make you a little worse. There's some other myths about rewarming, and people get kind of scared. Like if you rewarm them, you may shunt cold blood back to the central core and cause arrhythmias. And that is true. So if you take a profoundly hypothermic patient and dump them in a hot tub, you can kill them. It's pretty easy. You'll induce an arrhythmia. But if you put a cold person next to a fire, they'll warm up slowly. They're not, don't put them in the fire. That's a bad idea. But put them next to the fire. There are some good data that not necessarily hot tub temperature, but warm temperature baths. So, 40 Celsius. If you put extremities only in them, it does prevent the shunting. And so, yes, warm blood gets back to their central core, but not so hot that it'll cause arrhythmias. And they do warm up a little faster. What about, do these people really need to be just fixed instantly? Do we need to rush right to them? This is a tough one. So certainly in the Swiss Alps, they will use a lot of assets sometimes to recover hypothermia patients, or just photo ops for conferences, because there's no reason to have 4 assets on one mountaintop, apparently. But remember that hypothermic patients, while their physiology may be deranged, it's normal for a hypothermia body. So you may not palpate a pulse, you may not be able to see them breathing, but that's not something you're going to fix quickly, and it's not something you can undo. that fast. And you may, if you jostle them too much, you can induce ventricular fibrillation. So there's arguments between ILCOR and the WMS about whether or not you should start CPR on somebody just because you don't palpate a pulse. And if you put a monitor on them and they have what would normally be a perfusing rhythm and you just can't palpate it, and you presume it's PEA, they would recommend against doing CPR because that's probably still perfusing, because their blood viscosity is about 190% of what it normally is. And so the blood is moving. You're not going to get this amplitude pressure wave. You're going to get this slow wave that you're not going to palpate in their pulse. You're not going to see them breathing. And again, if you start CPR on them, it is really hard to stop doing CPR on them because you're probably going to induce a ventricular fibrillation. That being said, how do you determine if this pulseless cold person is alive or dead? And the easiest way, absent a point of care potassium measurement of greater than 12, is to extend an extremity. So dead people, if you extend their extremities, stay out. Living people will start to curl back in because the sarcomeres still work. And so that's the easiest and quickest way. It also determines, if you can't extend it, it means they're frozen, and you can stop there too because they're dead, right? So that's why we were discussing, should you do CPR? If you're going to do CPR on them, say you need to, you put them on a monitor and they're in VFib, and you're 100 meters from that 4-asset hilltop that you saw, amazing amount of helicopters. It is very hard to transport somebody with CPR in progress. We don't have very good data on whether or not a Lucas device is able to push against a very cold person's chest to get effective compressions. We don't know that. It's better than nothing, probably, but we just don't know for sure. Current WMS guidelines are, if you're going to do CPR, do it for at least 5 minutes because that's how long it takes to perfuse. And then because they're hypothermic, you can take a 5-minute break and try and move. And then after that 5 minutes is over, do another 5 minutes of CPR and then stop and then move again. Because again, that's why we used to cool people after CPR for coronary disease, was cold brains seem to do okay with hypoxia as opposed to normal brains, right? That's probably the best data as to why children do better with hypothermia than adults, because they cool a lot faster. And so that's actually neuroprotective. But you still want to perfuse it some. But you can still consider some people completely dead. If you have to dig them out of a snowbank that they've been in for 24 hours, or if they've got snow impacted in their airway, or again, if they are frozen solid, then they are dead. But if they're not, and you don't live in Switzerland, where you can do ECMO out of the base of an EC-145, slowly, there you go, then what do we do? Not a whole lot. Don't want to just let them get frozen. That guy's dead. He can be cold and dead. But there's things we know that we shouldn't do. Do not get in a sleeping bag with them. Certainly do not get in a sleeping bag with them naked. There's a lot of reasons behind that. Number one, their skin is cold and will not really perfuse well enough to get warmth from your warm body next to them. Number two, if you're a normal temperature and you're in the sleeping bag with them, you're going to start sweating. You're going to get wet. You're going to get them wet. And that's actually going to not help them warm up. Three, it is an HR nightmare. If you want to get a lot of emails from work, get in a sleeping bag naked with somebody. I promise. That is not going to go well for your career, but it might make the news for the wrong reasons. The hypothermia burrito is a really good way to warm up everybody but the most profoundly hypothermic. If you're not needing to do CPR on them, if they're awake and talking to you and breathing, this and this alone will actually warm them up enough to get you to the aircraft, most likely, or the ground crew, depending on where you are. If they're soaking wet, get the wet clothes off. There are people out there that have said, oh, well, if it's really cold outside and you cut their wet clothes off, now they're exposed to wet air. Again, wet air still conducts heat 20 times less than wet water. So you want to get the clothes off. People will say that if they're in a wetsuit, that will keep a layer of warm water next to their skin. Well, the problem is their skin's not warm, and it keeps a layer of cold water next to their skin. And that neoprene stays super wet for a really long time, and it's just sapping heat from their body. So get them naked. Maybe don't roll them around in the snow too much. But rolling around in the snow a little bit actually will dry their skin off. If they're soaking wet and you roll them in powder, it'll dry them off. But then stop quickly thereafter. If you've got a towel, use a towel. It's better. Ice cold water So 0 Celsius water is not necessarily instantly fatal, but it can be. So you can get in this water and you actually probably do okay for at least 5 to 10 minutes till your fingers stop working. There's a 0, 10 minutes, 1 hour, 2 hour kind of concept. So if you make it past the 0 minute mark, you're probably going to be okay. But a certain percentage of people, through genetics and just innate body problems, if you put them in ice cold water, will have a life-threatening arrhythmia and they will die right there. They won't die right there, but they'll drown, and then they'll die because they drown, because they won't be able to perfuse their arms and swim. But if they don't die instantly, they've got about 10 minutes to get out of that water. After that, they're going to stop being able to use their arms correctly. And if that 10 minutes goes by and they can't get out of the water, they've got about an hour before they'll actually be conscious. So you float there, not being able to do anything for about an hour, getting really, really, really cold. And then if nobody comes and finds you within that hour to 2 hour mark, after 2 hours, you're dead. There are some recommendations, sort of like how when they give these interesting expedition medicine things of how to protect yourself from a shark attack. And it's like punch it in the gills and punch it in the face and just hope the shark's not trying to kill you, basically. It's the same thing. It's like if you fall in water and you can't get out and your 10 minutes is almost up, what they recommend is getting your wet self onto the ice and freezing in place on the ice so that your head stays above water once you're frozen. I was like, well, that seems to be pretty optimistic about survival if your goal is to freeze your body above, head above the ice, but it can happen. There are other severe issues with hypothermia that are not just accidental hypothermia. So long-term issues with vascularity can cause frostbite. Frostbite in and of itself is not an emergency, but we actually should be treating it better than a lot of places do. And so once it happens, you can't undo it, but you can stop making it worse. And so if you get somebody like this, even if you're out in the bush, so the most important thing with frostbite is do not rewarm it if you can't prevent it from freezing again, because that secondary insult on the penumbra is going to make it worse. But if you can rewarm it, what they recommend is popping these blisters because they've got thromboxanes and other things that irritate the skin. Aloe vera gel has anti-thromboxanes, antiprostaglandins that seems to work better for inflammatory markers. Nurofen, so a 12 milligram per kilogram dose twice a day of Nurofen really actually helps prognosticate these. And then TPA or iloprost, which is a prostacyclin, those two things can prevent the thrombosis that occurs in these small vessels and allows you to recover as much tissue as possible. Those aren't things that we're going to be doing, but that's the kind of recommendations. You want to get them to a place that can give TXA so that they can keep the front third of their foot as opposed to losing their entire foot. Hopefully that doesn't happen. Like I said, the snowy mountains here aren't very snowy, but we still might see some cases of frost nip and mild frostbite. That being said, it is summertime in the northern hemisphere, and so we should probably talk about heat illnesses as well. This is the hottest measured temperature in the world. So this is Death Valley. It was positive 53.9 Celsius, although that measurement, there's some argument of whether that's a real measurement or was reflected, but the surface temperature there is about 98 Celsius actually. So you can cook eggs on the ground there. Hottest temperature in Australia was just across the bay from Exmouth out in WA in January of this year, and it was 50.9 Celsius. So we've reached the hottest temperature ever in the recorded history in Australia this year alone, in the absence of wildfires. So you get pretty warm in a lot of places. We've been studying heat illness for a while. So this is the Secretary of the Royal Society of London, again, back before IRBs existed. He went into this kind of steam room sauna thing that was at 105 Celsius. He took a dog, he took some eggs, and he took a piece of steak. He lasted about 12 minutes, came out, his heart rate was 136. He's like, yeah, it's too hot, I'm done. Left the dog in there for 30 minutes. The dog came out okay too. Thankfully it didn't die. But the eggs and the steak were both cooked. And so they're like, I wonder why dead things cook and living things don't cook. That's weird. It's because of heat shock proteins and because living things can transmit the heat. The most efficient way for us to lose heat is not that conduction. Well, it is, but the most efficient way normal bodies lose heat is evaporation. The problem with evaporation is it only works if the humidity is less than 70%. Once you hit 70%, all you are is wet and hot because it doesn't evaporate off and cool you like it should. Men do sweat more than women. Athletes sweat more than non-athletes. You can learn this skill if you live in hot climates. Interestingly enough, the reason hot climates like chili peppers is because if you eat a chili pepper, it makes you sweat, which actually cools you down. So that's why those cultures have done that. But heat exhaustion and heat stroke are a similar scale to cold injury, but you notice it's a much narrower range. So you can live down to negative or positive 9 Celsius, although not well. You can survive. You can live at 13.7 Celsius. And we've got a lot of case reports around 20 degrees. So you can be 17 degrees colder Celsius than normal. Once you go more than about 5 Celsius hotter, you're dead. So there's not a lot of case reports of people surviving at 42 Celsius. It is we have a much narrower range of temperatures that we can survive in that time frame, which makes heat illness, unlike cold illness, a much faster time frame emergency that we need to deal with. Cold people, you can hang out for a while. They'll probably be okay because if they're dead, they're going to be dead. But if they're going to live, you don't need to have them treated in the next 10 minutes. Hot people, if they're going to live, you need to treat them instantly. Similarly, though, to cold illness, so heat exhaustion, you start losing coordination. You kind of start slurring your speech when you get towards heat stroke. There are old papers and teachings about whether or not the presence or absence of sweat indicates stroke versus exhaustion. Absence of sweat just means you're dehydrated typically. You can have exertional heat stroke and be sweating profusely and just not able to do it. So don't be like, oh, they're still sweating. They're fine. They can still be really ill. The easy thing is heat exhaustion and heat cramps, which is the even milder case of heat exhaustion we don't even talk about, is easy. You just hydrate these people. There's nothing you need to do. You can hydrate them pretty well. Once you get to heat exhaustion, cold compresses, fluids, have them lie down. Because remember, these people are still conscious. They don't have any altered mental status. That's why they're not in heat stroke. They're just in heat exhaustion. You can use a fan to lower temperature, which is great because we have a collection of really big, really high-powered fans. And in the great, two presentations that have the same photo back to back, there's a case report in Aviation, Space, Environmental Medicine, which is now ASMA, of doing this. And so putting wet sheets on people and then running the big fan over them does cool them down better than not doing anything. Still not the greatest, and you run the risk of the sheet blowing up into the rotor blades and other stuff. So it's always one of those amusing things to just talk about. But we do have air conditioning in the aircraft, and so you can put them in the aircraft and then blow air conditioning. Or if you've got a car, throw them in the car, turn the AC on, get them cool, get them out of the hot environment. As I mentioned earlier, if you're on a boat with a stethoscope, you're doing something wrong. If you're jogging an ultra marathon out in the outback, I'm not sure why you would have the stethoscope in. I don't even know what she's carrying, like where this thing was, like in a pocket or something, and why she's listening to his bowel sounds. But heat stroke is when you start getting any mental status change. And so they don't necessarily have to be above 41.1 Celsius, although they usually are. But people at 39 Celsius who are confused have heat stroke. And it's brain at that point. And those are the people that we need to treat the fastest. Marathons is a common one. So that's why they do screening of people when they're finished marathons or anytime they go into the tent, because they want to make sure that their mental status is there because it can change treatment. We used to say, oh, well, these people need to cool down fast, so let's get some cool packs or ice packs and put them in these high flow areas. Don't do this. You can do it as long as you're doing other things. But the problem with this is these high flow areas don't have enough contact time with the cold packs or ice packs to actually cool the blood. And so if you're going to use any kind of ice pack system, put it on glabrous skin, put it on palms, soles, and cheeks, because the flow is slow enough there for the actual thermal transfer to go from the cool pack to the skin. If you try and cool a fast moving stream of water, it's not going to cool down fast as that's why radiators exist, because they transfer heat better through a lot of capillaries as opposed to, just a hose. Don't use chemical cold packs at all. They don't stay cold long enough. They don't work well enough. And again, they just aren't good. You can, however, use ice packs or ice water and put it in towels and drape their body, cover their body as much as you can, swapping the towels out to make sure they keep staying cold. You're not going to give these people frostbite, so don't worry about it. I wouldn't put a solid chunk of ice on them, like you can hurt them, but it's really hard. If you've got it, use one of these. And so in Texas, where we like to shoot kids apparently, but we also have a lot of heat injuries, especially with the Baton Death March, which is weirdly named because it's not anywhere near Baton, but it's this ultra marathon out west. And so what we do is we take tarps and put them in the beds of utes and make tubs outside for people and just have those kind of strategically lined up. Most hospitals don't have these tubs, but they sometimes have them in like the wound care center for like wound baths. And so if you can get access to this and just dump a bunch of ice in it, put the person in it, keep their head above water, this will cool them down significantly faster than anything else. And we know this because we used to do all of these things where, oh, let's put an IDC in them and we'll lavage cool water through their bladder, and let's put a gastric tube and let's lavage cool water through their stomach. That actually doesn't work very well. It doesn't cool them down significantly enough. You can cause a lot of morbidity by trying to do the 2 chest tube method, where you put cold water in the top of the chest tube and out the bottom and cool their thorax. None of those work any better than this. And so just dunk them, just keep their head above water and dunk them. And then the last thing, it doesn't take extremely high temperatures to get profound heat stroke. So this collegiate football player, so college sports in America is a big deal, but this collegiate football player, it was 26 Celsius outside. It wasn't even a particularly sunny day, but he worked himself up into heat stroke, and because they failed to identify it and failed to treat it, he died as a 21-year-old. And we know that ice bath, like I mentioned, so if you start cooling within an hour of initiation, you decrease their morbidity like 5-fold. It's like 20%. Whereas if they've been hot for an hour or longer, they have 5 times the mortality. So you don't want to start cooling them as fast as possible. Again, opposite the cold injury thing. Both of these groups, you want to hydrate, you want to make sure. Our MECUs, so if you want to give them warm fluids for cold people, our MECU will only warm it up to about 37, maybe 39 if you're lucky. That's not a bad idea to consider, but everything else we do is just going to be kind of non-invasive methods. The only invasive heating thing you should do is ECMO, like those guys in Zermatt were doing. And that is a rapid fire heat and cold emergency before lunch. That's not bad.
Cool. Before we have lunch, any questions from the group? Just to say that our experience of heat illness is quite extensive. We see a lot of people, particularly in bushland settings, and winch down to people. And the biggest mistake we make is not measuring a temperature. And if you don't measure a temperature, you don't realize they're hot. You think they're for some reason unconscious from a head injury. So we have to really be reminding ourselves that it is an important vital sign. We've seen a lot of heat stroke combined with serotonin syndromes in the music festivals from about 3 years ago, where there was a whole string of deaths, and medical teams were sent to stop them dying. And I think in total we intubated more than 30 patients with serotonin syndrome. And it is remarkable how quickly just the act of general anesthesia cools patients. Probably not documented well, but when we had central core temperature measurements, we were dropping them by sort of 1.5 to 2 degrees within half an hour just from general anesthesia alone. And that's particularly important in serotonin syndrome, where it's not actually the environment as much as the body themselves making the temperature. And until you relax the muscles and stop them from generating their own heat, that they don't cool down no matter what you kind of do externally. And because they're often unconscious as well, you can't dunk them in ice because you can't really manage their airway. So not an ideal situation. Any other questions from the group?
In that regard, serotonin syndrome is more like malignant hyperthermia. The Wilderness Medical Society, they've tried to do some data on dantrolene for exertional hyperthermia, and it doesn't seem to work as well because the issue is not purely a muscle constriction thing. It's not harmful, but I wouldn't start with doing it. But yeah, obviously, if you can prevent their muscles from contracting, they're not generating heat from the muscles anymore, and then they will do it. Because you'll see some of these people who are moderately hyperthermic shivering because they're just cold, and it's going to raise their temperature even more.
And that's the risk of putting ice on the skin, is that people start to shiver despite being centrally warm. Because actually, the interesting thing is humans don't have any central temperature measurement or detection. We only have skin.